Hello and welcome to the Provincial Medical Sign Language Interpreter Services Virtual Town Hall. My name is Scott Jeffrey, and I'm the Sign Language Coordinator at Provincial Language Services. And I will be hosting tonight's presentation. I am wearing a dark blue button-up shirt. I have black glasses and a blue background. I would like to now do our land acknowledgement. Provincial Health Services Authority provides services to a diverse population in various settings and communities across BC, including Indigenous people. As a provincial network, we operate on the unceded, traditional, and ancestral lands of many Indigenous peoples. I am grateful to work currently remotely and play in Langley, the unceded traditional territory of the Katzie, the Matsqui, and the Kwantlen First Nations. Our main office is located on the traditional and ancestral lands of the Coast Salish peoples, including the territories of the Tsleil-Waututh, the Musqueam, and the Squamish nations. Thank you. Today, we will be discussing 4 things: the Provincial Language Services and the Provincial Medical Sign Language Interpreting Services. The first topic will be our Community Advisory Group. We will get to meet the members, learn their roles, we will learn about the PLS Sign Language Coordinator, roles and responsibilities. We will learn about Provincial Language Services, the projects that they've been involved in. We'll have a brief update on that, specifically around Video Remote Interpreting, VRI. We will look at PMS LIS, the timeline of activities. We will also announce who won the contract to be the vendor. So a PMS LIS timeline, what we've been working on in the past few years. In August 2017, PLS began engaging the deaf, deafblind, and hard of hearing community. In June 2018, after collecting all of the feedback, PLS developed and shared the new service model with the community. In November 2019, PLS established the Community Advisory Group. In April 2020, PLS hired a deaf-led sign language coordinator. In September 2020, VRI was established in all emergency departments in the Lower Mainland and Vancouver area. In October 2020, VRI was implemented on all BC Emergency Health Services iPhones. In April 2021, PMS LIS signed a contract and announced who the vendor would be. As we move forward, we will announce our service mapping, which will indicate when sign language interpreting services will be covered and when they will not within the medical system. And that will be launched on the PHSA website. Moving on, I would like to talk about the Community Advisory Group, which we call the CAG. The CAG was established by PLS in November 2019. This is an example of community engagement that is meaningful, ongoing, and inclusive of the diversity of the deaf, deafblind, and hard of hearing community. The main reason the CAG was established and the overall engagement process is the desire to create equitable access to care for deaf, deafblind, and hard of hearing patients. The CAG members were chosen based on set criteria. The first one is geographic representation across British Columbia. We wanted people in Vancouver area, Central, Vancouver Island, northern areas as well. We wanted diversity from across British Columbia. The second criteria was diversity related to language. We wanted deaf individuals, deafblind, and hard of hearing people. The third criteria is actually a group of 6 criteria. We were looking to have more variety based on these criteria: age, Indigenous ancestry, gender identity, representatives from city and rural areas, immigrants and refugees, as well as Deaf Plus representation. Based on those criteria, we were able to recruit 8 members to the CAG with diverse experience and language. I'll now lay out the members of the CAG. Amar Mangat is from the Lower Mainland. Amar is deaf, LGBTQ, person of color, as well as a youth. Craig McLean is from the Lower Mainland and is deafblind. Dan Braun is from the Lower Mainland. Dan is deaf, as well as a parent of deaf children. Gordon Rattray is from the interior of BC and is hard of hearing. Leonore Luke is from the Lower Mainland. Leonore is deaf and a senior. Monica Lane is from Vancouver Island. Monica is deaf and a parent of deaf children. Nancy Zavaglia is from northern BC, and Nancy is deaf. Sarah Taylor is from the Lower Mainland, and Sarah is deaf. We are still looking for an Indigenous individual, as that spot is currently empty. We are looking also for someone to represent the northern area, as well as an Indigenous person. Those two spaces could be filled by one individual if they are from the north and Indigenous, or could also be filled by two individuals. If you know someone that would be a good fit for this group, please send an email to pmslis@phsa.ca. Now that we know the CAG members, I'd like to outline their roles. We've chosen the 8 CAG members based on the diversity of deaf, deafblind, and hard of hearing. They have now established themselves as a group, and that group works with PLS, consults with PLS, and PLS works closely with the advisory group. The advisory groups provides feedback around accessibility issues and sends that information to PLS. PLS then listens to all of that input and feedback, develops projects, and engages with the community at large around those issues. PLS also works closely with interpreters, healthcare providers, doctors, specialists. And the commitment for the CAG members is a term of 3 years. When the CAG was first established, meetings were held monthly. That has now changed to meetings being held quarterly, every 3 months. That doesn't mean, however, that if something comes up, meetings must wait that 3-month period. Meetings can be called at any time when needed. Moving on to the role of the sign language coordinator. I was hired at Provincial Language Services, and I have 3 areas of responsibility. The first is Provincial Medical Sign Language Interpreting Services, PMS-LIS. And the responsibility there is to have oversight of the contract, working closely with the vendor to make sure that they are providing all of the things indicated within the contract, making sure that we're taking information from the community and that's being provided as effective service in interpreting for the community so that they get equal access to healthcare. I work with healthcare providers, working closely with clinics, supporting their operation, engaging with them to make sure that deaf, deafblind, and hard of hearing individuals are getting equal access to healthcare. Provide awareness, education, and training, and information related to the health authorities around how to best support deaf, deafblind, and hard of hearing patients. I meet with program leads to discuss tools and develop new resources for their staff and educate them and train them on how to use those, especially around if a deaf, deafblind, hard of hearing individual presents themselves, what is the right way to provide effective access. The third area is community engagement. I engage with deaf, deafblind, hard of hearing individuals and the community across British Columbia, listening to concerns, comments, feedback, as well as sharing out projects that we are working on and have been completed. The goal is to be fully transparent in the work that we do. I work closely with stakeholders, making sure that clients, individuals, anyone that needs interpreting services can get those services. I also work closely with interpreters within the community, considering their concerns and issues that they face within health authorities and interpreting in the medical settings. Next, we'll go over the Provincial Language Services, PLS, ongoing projects. Video remote interpreting has been established within emergency departments in the Lower Mainland. There's some in Vancouver Island, some in the interior, and we're working to establish more all across British Columbia in the near future. VRI has also been set up in BC Cancer locations, in the Vancouver, Surrey, Abbotsford, Victoria, and Kelowna locations. VRI is also available in most Vancouver Coastal Health and Fraser Health vaccine clinics. We have also worked with BC Emergency Health Services to put VRI on those paramedics' iPhones. We have also been working on service mapping. And that means creating something online that has all of the information needed to figure out whether interpreting services will be provided or they will not be provided. We will have it in written English as well as signed videos. And the goal is to have transparency for the community to see when interpreting services will be paid for and provided and when they will not. This project is in partnership with the Deaf Wellbeing Program. The Wellbeing Program is responsible for mental health services within BC. And making sure that we provide services within all areas with doctors, specialists, hospitals across British Columbia. We want it to be clear and easily understandable when interpreters will be and will not be provided. So individuals can look at this site, whether that's doctors, specialists, etc., to see when they need to arrange for interpreting services. We'll now show a short video from the BC Ambulance Services around VRI interpreting. It's very short, and it just gives you a brief understanding of how it works with.
Okay, Yassi, we're giving you a little something for the pain. How are you feeling now?
Oh, I feel better, thank you.
Finally, we'll talk about Provincial Medical Sign Language Interpreting Services. We'll talk about how things have been in the past. What things look like are laid out here. PMS, LIS, the agency responsibility would be to do the intake, booking, dispatch, looking for interpreters, writing down the outcomes, whether they had found an interpreter or not, recruiting interpreters and interveners, educating healthcare providers, doing community outreach, establishing policy guidelines, sector and workforce development, creating strategies for remote community access, and strategies around serving diverse communities. This shows the community model that was established last year. We will break this down and explain clearly the different parts of this model. We will start with the middle, the blue parts. The service values. We value communication access and respect above all. The green circle, the second one out from the middle, talks about service delivery, the principles around that. It was found that a deaf-led group must be established. There must be inclusive service delivery across the province, equal access with technology and for booking. There must be continuous community input available through different mechanisms. A clear access to information as well as transparent guidelines. As well as having deafblind individuals, deafblind and hard of hearing individuals easily access their choice of preferred interpreters. When we look at the final ring, we will look down at the bottom. The blue buttons are the responsibility of PLS. So that is, we will take on the strategies for meeting the needs of diverse communities. We will look at strategies for providing access in remote communities. We will look at sector and workforce development. Policy guidelines will be established by PLS. Community outreach will fall under the responsibilities of PLS, as well as education and promotion of information to healthcare providers. The interpreting agency, the vendor, will be responsible for doing intake, for booking appointments. They will be responsible for dispatching, so calling interpreters to fill those assignments. When they get a request, they will be responsible for filling that with an interpreter. They will also be responsible for interpreter recruitment and managing the contracts that they have with those interpreters. And that is just a brief summary of the service delivery component. So the agency itself will now be responsible for the following things: any intake requested by the patient or PLS. They will dispatch the interpreters. They will make sure to record the outcome and communicate that to the patient or PLS, as well as improving and increasing the number of interpreters and interveners and managing those contracts. Moving forward, Provincial Language Services will be responsible for education and promotion to healthcare providers, community outreach, establishing policy guidelines, sector and workforce development, creating strategies to provide access in remote communities, as well as strategies for serving diverse communities. PMS LIS medical interpreter screening will be established as a neutral, out-of-province screening team to assess interpreters that are interested in becoming medical interpreters. This is a new project that has just begun, and when there's more information available, it will be shared with the community at a later date. Now, we'll talk about booking interpreters. There's two different ways that can be done. The first one would be patient booking. A deaf, deafblind, or hard of hearing individual can book through the interpreting agency, as has been done in the past. Or the patient can connect with the doctor or service provider and have them do the booking. So a patient could connect with the agency would find an interpreter, and the interpreter would show up to the appointment. That is the same as how it has been done in the past. The second option is for the healthcare provider. We now have a one-stop shop for booking interpreter services, and that was established based on feedback from healthcare providers. PLS has provided spoken language interpreting services for many years. Healthcare providers have indicated that they are confused by the need for two numbers to connect either with spoken language or sign language services. So based on that feedback, that number has been combined into one. If you need to book any interpreting services, you just phone one number and you could get any spoken or sign language interpreting services. So the healthcare provider can, when they are making an appointment with a deaf, deafblind, hard of hearing individual, they can call and get an interpreter at the same time. And then PLS will connect with the agency, and the agency will look to find an interpreter. The interpreter that would then show up at the appointment. Quality assurance. Quality assurance processes are an opportunity for patients and healthcare providers to submit comments, feedbacks, or complaints around their service. There are two different areas: interpreting and intervening services. If there's compliments, feedback, etc. around those services or concerns or complaints specific to interpreting or intervening services, you would connect with PLS Quality Assurance. An investigation will be done. We get that information and provide that information to the agency, who will do that investigation of the situation. And when that is completed, they will provide the outcome to be filed at PLS. The second quality assurance is for the healthcare providers. If there's compliments, complaints, feedback, or concerns around the services at a hospital, you would connect with the Patient Care Quality Office, PCQO. And it is important that any time that there is a comment, question, feedback, that it is taken care of immediately, the next day if possible, because the longer you wait, the harder it is to try and solve some of those issues. PMS LIS, request for proposal. Prior to the RFP proposal process, we updated the contractual requirements for the vendor to make them more stringent. We also added new requirements for quality assurance and reporting. The CAG was fully involved in the establishment of the new vendor requirements. Before we started the request for proposal process to select the new vendor, they were not able to participate directly in the process to select the vendor due to government regulations, but they provided key input on the criteria that was used for selection. The evaluation committee reviewed the bids, and it was led by a senior buyer within PHSA. And there was also an evaluation committee. There was 4 members involved: myself, the sign language coordinator, the PLS director, PLS language services coordinator, and the PLS program manager. The 4 of us were involved on the evaluation committee, along with the senior buyer. And the choice was made following the distribution of points. There was 4 of us, and we individually scored each of the RFPs based on the RFP requirements. We looked at the bids, we saw their offers, we saw if there was any value added. Each individual scored the bids. We gave that information to the senior buyer, who put all of the information together. And finally, 1 bid remained. It was evaluated on points, clarity of the presentation, and again, this process was led by the senior buyer, following stringent legal requirements. And after this stringent process, we were able to select a new vendor. We found that one agency was able to meet all of the requirements, and that agency is Wavefront Center for Communication Accessibility. So congratulations to Wavefront Center for Communication Accessibility. We also want to thank all of the other applicants who submitted bids. If you have any questions, please contact us at any of these contact methods. So it could be by mail, or it could be by email at pmslis@phsa.ca. Thank you so much for your attention this evening.